Hi, it's Ben. In this video I'm going to talk about commonly prescribed pharmaceutical drugs and their benefits and risks in managing the symptoms of eczema. So many eczema patients are prescribed with creams like topical corticosteroid creams, an antibiotic pill, sometimes oral steroids, antibiotic creams, allergy or immune suppressing creams, antihistamines, and sometimes painkillers and anti-inflammatories. And I'm also going to discuss vaccinations. Now, all of these medicines are proven through a huge number of scientific tests to reduce the symptoms of eczema. But they can potentially have an adverse effect, and the problem that I see, although bearing in mind I'm not a medical doctor, is that the tests which show the efficacy of these medicines are short-term, whereas there are very few long-term tests which cover the adverse effects of these medicines. That means that people often using them for a long time don't expect what happens to them, and what happens to them can be very serious and potentially life-changing, and in particular in relation to topical corticosteroid creams. So I don't want to alarm you, and bear in mind that I'm not a medical doctor, so I've done quite a lot of research, but I don't think I am, but I could be wrong, and please correct me if I am wrong. So first of all, I'll cover topical corticosteroids, and I think I'll just give you some background on my use of topical corticosteroids. I had severe eczema at the age of about 15, and I'm 33 now, and the symptoms for the last 5 years I've been able to manage my symptoms very effectively. Except for a period of about 6 months where I had a severe relapse. And I haven't used topical corticosteroids during that time. But between the ages of 15 and 28, when I was at the age of 15, I was first prescribed with topical corticosteroids. I was using certain creams with varying degree of strength on my body, mostly on my face, but sometimes almost all over my body, probably twice a day. Now, when I was first prescribed with the creams, I was told that I got no points or no sort of credit in terms of my health in staying off the creams. This was by my medical doctor, and that I should just use them to suppress the symptoms. Another medical doctor tried to stop me using them, and I was so addicted to the creams at the time that I changed doctors and got a prescription from another doctor. And the reason that I was addicted was that, one, because I was ignorant and didn't know about the information that I'm sharing in these videos about managing eczema naturally, and also because I just wanted to fit in and be like everyone else my age and go out and have a few drinks at the weekend, eat junk food, and not really make any what seemed to be radical or even small changes to my lifestyle. So it allowed me to go on with a degree of comfort and really ignore the problem in a sense by suppressing the symptoms and not dealing with the root causes as far as possible. So following stopping using them, I've had a number of tests and have found that I've got an adrenal insufficiency, which means that my body at the moment doesn't produce as much cortisol as it should, which is the stress hormone you needed to recover from stress. And it appears that that is a common side effect of the use of topical corticosteroid creams, and I'll go into that later. Now, on the one hand, they can be very, very useful. So these are creams like betnafate, fusobet, hydrocortisone and umavate, some of which are available over the counter, and stronger ones are available by prescription. And they work by introducing cortisol into an inflamed area of the skin. Cortisol is a hormone which is produced by the adrenal glands, and it deals with inflammation and stress in the body. So it soothes inflammation, stimulates growth, and allows, when applied to the skin, the cortisol in the topical corticosteroid allows the eczema, the damage, to heal very quickly. And the steroid also blocks the release of histamine, which is in the skin, which is responsible for the itching sensation. And so it as well as healing the skin quickly, it reduces the itching. And so this is why the steroid creams are really useful in an emergency situation where you're covered in eczema and it's out of control, and it can have an almost seemingly sort of miraculous effect. However, you know, all steroids come with a warning leaflet, as do most pharmaceutical medicines, and a good doctor will tell you not to use the steroids for too long. Most users of topical corticosteroids tolerate the creams well in the short term, but long-term use can have negative side effects. So in the article that I will link below this YouTube video, which is available on my website, I will put references to the studies that I refer to in this video. 4 studies in particular of topical corticosteroid use in healthy volunteers show that after 6 weeks of using the steroid creams, the skin thins. Now that's skin thinning reversed within 4 weeks of stopping, so that suggests that there's a 2 to 3 time period for recovery. Now, if you've been using recovery of skin thinning, if you've been using topical corticosteroids for years, that means that it could take a very long time for thin skin to recover, which means that you get something called red skin syndrome, and also very sensitive, easily damaged skin as a result of using the topical corticosteroids. Now obviously, if you suffer from eczema, you need your skin to be as strong as possible if you're going to have any chance of managing the symptoms naturally. So these studies suggest that topical corticosteroids should be used in bursts of 1 to 2 weeks, followed by rest periods of at least 10 days. So the commonly reported side effects of using steroids in the long term are, as I said, thinning of the skin and red skin syndrome, skin depigmentation, abscesses, and others include growth retardation in infants and children, adrenal insufficiency, osteoporosis, which is where the bones basically leak calcium and become weak, and glaucoma, or loss of vision, where you use creams near your eyes. I've put a playlist on my website, on my YouTube channel, with a video from an Englishman called Richard Mattox, who used topical corticosteroid creams near his eyes for many years, and the last video he uploaded is very disturbing because he says that he's basically lost the sight in one eye as a result of using topical corticosteroid creams. So, and when I was using topical corticosteroids, I often noticed I would have a floater in my eye, or a fluttering eyelid, or a slight ache in my eye. And I haven't found any studies which go specifically into this issue, but it appears to me to be a very serious risk. So if you are using topical corticosteroids, I could be completely wrong, but I would suggest that you try to avoid using them near your eyes. Now, in terms of the adrenals, the adrenal glands, what happens when you use topical corticosteroids is that they're absorbed through the bloodstream into the skin, and once they're in the bloodstream, you have a gland near your brain called the pituitary gland, which stimulates your adrenal glands, which are 2 little glands below your kidneys. It stimulates them to produce cortisol, the stress hormone. When you've got cortisol coming in through the blood, the pituitary gland is tricked into thinking that your body's producing enough cortisol, and so it doesn't stimulate your adrenal glands to produce your own natural cortisol. Then, when you stop using the topical corticosteroid creams, depending on your body and also how long you've been using them, the amount of stimulation or the decrease in stimulation to the adrenal glands can atrophy the adrenal glands, and so you stop producing more cortisol, or enough cortisol for you to do sort of day-to-day functions, and that can be very severe. I mean, low cortisol can lead to death in some cases, but in most cases it will just mean tiredness, inability to recover from exercise, low ability to handle stress. And the body can, many people recover, but some don't. So it's definitely something that you need to be aware of, and obviously if you can avoid using the steroids and you can manage your symptoms naturally, that's something that you want to try to do. Another problem is corticosteroid addiction. So if you don't do everything you can to manage the symptoms naturally, including making changes to sort of the location you live and that sort of thing, then your skin becomes thinner and the eczema gets worse, and you become totally dependent and reliant on these creams, which increases the risk of adverse side effects in the future. So obviously that's something that you want to avoid. Antibiotics. Antibiotics can be really useful for eczema sufferers in getting rid of a severe skin infection, and topical creams with antibiotics are often very effective. However, oral antibiotics, which are prescribed for many different things, can lead to problems which are linked to eczema. One example is an increase in the overgrowth of a yeast called Candida albicans within the digestive tract. High levels of Candida albicans have been linked to eczema, and antibiotics have been shown to increase the amount of Candida, because antibiotics, as well as destroying bad bacteria, can destroy good bacteria. When good bacteria are destroyed, other more harmful microorganisms can flourish, like yeasts. In particular, children with a reduced diversity of microorganisms, particularly good bacteria, in their colon and their small intestine and large intestine, have been shown to have an increased risk of developing eczema later in their childhood. So data covering almost 14,000 children between the ages of 16 and 17 showed that the prevalence of eczema in that population was 7%, but the children who received antibiotics in their first year of life was 66% more likely to develop eczema later on. And so early childhood use of antibiotics can increase the risk of developing eczema, as well as other immune disorders like asthma and hay fever. This shows that the development of the immune system in young children is linked to the development of the gut flora, or the beneficial microorganisms that live within our guts and help us to do things like digest food, recognise harmful substances properly, and also attack and eliminate unwanted microorganisms. And then another study of antibiotic use in children, which used data for almost 30,000 children, again showed that antibiotics can increase the risk of asthma, hay fever and eczema in children. So in particular, it's quite important that, if possible, a child should not take antibiotics earlier on in their life. Now, I'm not a medical doctor, so that may sometimes be necessary, but I think it's something to be aware of, and it's not often information that will be provided to you by your sort of general practitioner or medical doctor when you see them. Another thing, painkillers. Painkillers are linked to a reduction of the diversity of flora in the gut, and also they increase the toxic load on your body. Now, if naturopaths are right and eczema is partly caused by a detoxification process through the skin, then it makes sense that you want to avoid the toxic layer, so as well as avoiding harmful foods or less healthy foods, you also want to avoid painkillers. Finally, vaccinations. Now, if you have a look on Wikipedia, there's a disease called Eczema vaccinatum, which is severe eczema experienced mostly by children as an extreme reaction to vaccinations, and it can be fatal. Following vaccination, a child can be covered head to foot in such severe eczema that they basically itch themselves to death. So, in particular, the risky vaccination for eczema sufferers is the smallpox vaccination, which I don't believe is, perhaps I'm wrong, but I don't believe is a part of regular vaccinations for infants. And most medical doctors, although not all actually, will tell you that most vaccinations are safe and that there's a very low risk of eczema vaccinatum. But the Centres of Disease Control and Prevention website states that anyone with any history of eczema or atopic dermatitis should not be vaccinated with a smallpox vaccine. And there have also been links, other vaccines have been linked to eczema vaccinatum as well. So again, I mean, it's a confusing topic and probably best left to the medical doctors, but there seem to be a large number of physicians out there, including medical doctors, who have become very sceptical of vaccinations, particularly where an individual has a compromised immune system and allergies like hay fever or eczema. And it appears that an adverse reaction to a vaccination is more likely in patients that have a compromised immune system or are susceptible to genetically to diseases like eczema and hay fever. So I'm not saying whether or not you should have any vaccinations or not, but what I am saying is be aware of the full range of medical opinion on this subject, because it's not, doesn't appear to me that there's an absolute consensus. And you may want to consider or not whether giving your child 10 vaccination shots at the same time when it has a risk of eczema or already has eczema is something that you think is a sensible thing to proceed with. So finally, I think that what I'm trying to hit home with this message is that if you've got severe eczema and you're not coping, then in the short term, pharmaceutical medicines can be really, really helpful. They can destroy a bacterial infection, and they can, reduce inflammation, heal the skin, reduce the itching very, very quickly. However, doing that is essentially like painting over rust. You're not dealing with the underlying symptoms, particularly allergies. You're not dealing with environmental factors. You're not dealing with lifestyle. You're not dealing with, nutrition and allergies to foods. So you're painting over rust. You're not actually doing what you can to allow your body to thrive in a more natural state, and you're increasing your risk of adverse side effects the longer that you use those medicines, particularly topical corticosteroids. So I definitely proceed with caution and do what you can to improve your health so that you can manage eczema without having to use these medicines or without using too many of them. I personally have allergies to most proteins. However, I realise that I do need to eat protein every day to be healthy. So I do use antihistamine, and I find it helpful. However, antihistamine can have a long-term effect. Now, I haven't found a way to cope without using them yet, but that's just an example of where pharmaceutical medicines can, when there's no alternative, really be helpful for us in managing our symptoms. And maybe if you're only using a very small amount of topical corticosteroids and you're having significant breaks, then that might be helpful for you. So it's finding a balance that you can cope with, that allows you to live a normal life. Anyway, I hope that's helpful, and it'd be interesting to hear your sort of stories or any information that you have about the uses and risks and benefits of prescribed pharmaceutical medicines and eczema. And if you like the video, please give it a thumbs up and comment and subscribe. And if there's anything that you want me to cover in future videos, please let me know. Also, if there's anything excuse me, that you think I've got wrong, please let me know, and I'll be happy to try and amend the article on my website or do an update to the video. So thank you for watching.